Mexico City, its streets bustling despite the maximum alert level for COVID-19 infections. Isael Garcia would rather not be here, but working in the centre of the nation's capital, he has no choice.
We'd all be at home protecting ourselves if we didn't have to worry about the need to work. It's not only about personal responsibility, it's about economic responsibility.
That has been a common complaint since the outbreak began, and not only in Mexico. While it may be back to business as usual here, the emergence from lockdown belies a more serious situation. Latin America has become the world's most infected region, accounting for almost 1/3 of the global caseload. Countries throughout the region have struggled to manage lockdown protocols as social and economic factors get in the way.
These times have been the hardest we have faced since the Second World War. We know it has affected all of us, some of worse than others. We know many have lost loved ones, and many more have been hurt. But I want to send a message that as a country, we must be united and not let our guard down.
There is a positive side to a high number of cases. It generates herd immunity, which occurs when a large percentage of a population survives infection and develops antibodies. The recovered become a firewall against the disease. But here, immunity is still a long way for many Latin American countries like Brazil, where COVID-19 is still rising sharply.
El gobierno de México en ningún momento.
At no point has the Mexican government thought of deliberately using the herd immunity phenomenon as a pandemic management strategy.
No nation can afford to. Collectively, the pandemic has cost Latin America more than 250,000 lives, more than any other region in the world. With the pandemic nowhere near under control, the IMF predicts Latin America's GDP will shrink by around 9.5% this year. Alistair Baverstock, CGTN, Mexico City.